Leah came in with new onset arm symptoms, arm pain, and she had, I believe, some numbness, and she had tried over a few weeks to have conservative therapy and give it time, and she just really wasn't getting any better.
I was in a lot of pain. I was having difficulty at work. I was having difficulty sleeping. I basically had to sleep sitting up a lot. For as the grandkids, I wasn't really able to lift them up and really play with them a lot or do a lot of cooking or standing.
That's when she got an MRI scan that showed that she had a herniated disc in her neck. She also had some arthritis at other levels also, but there was one that was really bad. I talked to her about different surgical options. We talked about the more traditional surgery, the fusion, but because she had other levels in her neck that already looked bad, I wanted to try to prevent those levels from getting worse by being next to a fused level, and that's why I offered her the artificial disc replacement.
I love working out in the yard. I'm able to do that. I'm able to pick the grandkids up and play with them, do the cooking. My life is back to normal again. It's just hard to believe, that the surgery made my life livable. Where before I was basically in a lot of pain on a lot of different kind of medicine and getting injections. In order to have a life, I had to be on a lot of different kind of pills for relief. And once I had the surgery, all of that changed. And my family's happy, and I'm happy.
The recovery time for the artificial disc is actually shorter. You don't have to wait for the bone to heal solid. I tell patients the recovery time is about half as long, so about 6 weeks for an artificial disc versus about 3 months for a fusion, but that's all very surgeon dependent. So a good candidate for an artificial cervical disc would be a relatively young patient who has a fairly normal looking spine everywhere except maybe one level where there's significant arthritis at that level, but the arthritis isn't that bad to affect the curvature of the spine or the alignment of the spine. And most patients that get that surgery are usually ones that present mostly with arm symptoms and not very much in the way of neck pain.